Amazon is investing heavily in private healthcare. Their aims are to reduce the cost in countries like America that, for some reason, in 2022, don't have a public healthcare system. I'm here trespassing on a fulfillment centre to let you know why it matters to you and why we should all be paying more attention to it. They're doing this in 4 key ways. Firstly, Amazon Healthcare Centres. Currently, these are an employee-only pilot program, but they will get rolled out to everyone if it does well. You would go to an Amazon Care Centre for all your medical emergencies. Secondly, they're currently offering 24/7 virtual care for non-emergencies. I imagine some of this will be provided by AI in the future through their Alexa network. Thirdly, Amazon has been pushing hard into the pharmaceutical market, using its supply chain dominance in drug manufacturing. Imagine Amazon Prime, but for medication. Horrific. I know. Fourth and finally, they're investing in Amazon Diagnostics, with many job openings employing right now. And a lot of their labs are doing research into COVID-19. And they're creating in-home tech which will monitor you to tell you if there's an issue early on. For a minute, just for fun, let's put aside the fact that a private healthcare system profits off people being sick and assume that the reason Amazon is doing this is that we all live longer and buy more stuff from them. Kristen Helton, director of Amazon Care, which is an oxymoron if I ever heard one, said that patients are tired of a healthcare system that doesn't put them first. We want to be the option that puts them first. Reassuring, I'm sure you'll agree. When Amazon announced they were going into the prescription drug delivery service, shares in CVS, Walgreens and Rite Aid dipped. Amazon purchased PillPack for $753 million and then they rebrand it PillPack for Amazon Pharmacy, just to make it expressly clear their intention to go into the pills market. Prime members get 3 2-day shipping and discounts of up to 80% off generic and 40% off brand name drugs. Sorry, this is starting to sound distinctly like an advert. I promise, it's not sponsored in any way. Although PillPack technically runs as a separate business, it does get support from its business daddy through Amazon Pharmacy software, the fulfillment centres, and their relationship with healthcare providers. Part 2. Why is this bad? Aside from the obvious, Amazon can now track your conditions, your medication, and when you last had your prescriptions filled out. Couple this with everything they know about your shopping and window shopping, and now they have a competitive advantage that no company should have in the private healthcare space. If you're still not getting how I feel about this, imagine if you discovered that the atomic bomb was built and designed by the Red Cross, and you'll get some idea. In this video, I talked about how period tracking apps are using your data to help Facebook advertise products to you at the time in your cycle when you're most likely to buy them. Imagine that on steroids, which coincidentally you can now get on next day Prime shipping. Depressed? Here's a sun lamp. Anxious? Here's a plushie. ADHD? Nintendo Switch. Enjoying the video? Like and subscribe. Or maybe your marriage has broken down so they can show you ads for Xanax, Zoloft and Ambien. Dystopian future or advertiser's dream? It really depends on which side of the monopoly you fall on. The next level of predatory advertising is here. And yes, you could argue that they're just serving a customer in their time of need. Or you could see it as a vulture waiting around the corpse of a dying, broken human being to peck at their wallet until they pass away forever. You do you, boo. Oh, and shout out to whichever PR agency Amazon hired to push the idea that their workers don't need unions because they'll have healthcare. What's next? They don't need toilet breaks because you've given them all free catheters? Part 3. AWS for healthcare. You didn't honestly believe AWS wasn't involved, did you? AWS Cloud Computing supports the largest healthcare organisations and companies in the world, including Rush Medicine, Moderna, the Government of New South Wales, Philips, and the NHS. Are you fucking kidding me? And although Amazon doesn't say they have access to the data, I'd be shocked if it wasn't included in their terms of service. Or they could ask our government nicely. That also seems to work. Even if Amazon can't legally read the data on their servers, it still puts them at a massive advantage because they can literally turn off competitors' websites or collaboration research tools while they're developing or launching new products.
Once more for the people at the back.
The fact that Amazon controls the digital land that companies have to use to create future vaccines is an immediate red flag. Like when someone says, oh look, it's not a pyramid scheme, it's just shaped like a triangle. Or, in this office, we're just one big happy family. AWS launched their Healthcare Accelerator program for startups in the public sector. Basically, a 4-week technical, business and mentoring accelerator program to help them expand into the US market. Now, call me cynical, but I think this is their way of getting medical startups to showcase their products to Amazon so they can copy the idea, undercut the market, get rid of all the competition, and own it all. It's the oldest trick in a very specific playbook. Full video on how Amazon does this here. But hey, prove me wrong, Daddy Bezos. Prove me wrong. Part 4. Hardware. Let's overlook their new Alexa robot which follows you round, scans your home and throws itself down the stairs when it's had enough of being overworked. You know, like Amazon's real human workers. I want to focus on the Halo brand. Their answer to Fitbit when nobody asked the question. Halo tracks your sleep, body composition, nutrition, workouts and more. As if it was a good thing. It also contains a 3D body scanner. Alexa, tell me I'm fat.
Hey fatty, you need to upload a naked photo of yourself for me to analyze first.
I wish I was joking. Oh, and once they have the scan, the app will give you a little slider that you can drag from left to right to see what you look like with more or less body fat. So very much like a funhouse mirror, minus the fun. Ah! I guess next they'll be entering the mental health space to deal with customers with body dysmorphia, anorexia, or any number of body image issues. Oh, and it has an emotion monitor. Amazon made it clear that the microphone on the Halo band isn't meant for voice commands. It just listens to your voice and reports back on what it believes your emotional state was throughout the day. If you don't opt in, the microphone on the band doesn't do anything at all. They asked Amazon if the tone feature was tested across different accents, genders, and cultures. An Amazon spokesperson said, if you have an accent, you can use the tone feature, but your results might be less accurate. In unrelated news, Amazon complied with at least 2,000 law enforcement requests for intimate recordings of private conversations and domestic activities taken surreptitiously from Alexa-enabled devices in 2020 alone. I'm sure this is unconnected, but I'm just going to leave it there. It's also not a great look that their endorsements are terrifying and feel like they've been written by a primitive AI bot. Look, I'm not saying our National Health Service is perfect, far from it, but I love it enough that I can see pretty much all of its flaws. But one of the biggest perks of living and working in the UK is that if I get ill, at least for now, the state doesn't let me die. So this question is more for my American viewers. Is this really a better option than a socialised healthcare system? Let me know in the comments below. Godspeed, I'll see you all next week.